Hey there, I wanted to talk with you today about Medicare. So, Medicare is for those who are turning 65 or have qualified special needs for early enrollment. And Medicare can be covered through original Medicare, your Part A, your Part B, and then a supplemental or an Advantage plan. So, that's an essence of kind of Medicare at a very high level. And nobody ever said that insurance or Medicare specifically was ever easy to understand. They don't make it very easy. But what they will do is they will inundate you with information for the first year that you're turning 65 with lots of information that's difficult to digest, and they use different terminology, so it makes it very confusing. So we're here to help you understand Medicare, and more importantly, help you navigate to pick the right plan, because what might sound like the right plan for you today from a long-term perspective might not be the best option. Really, from a supplemental perspective, if you're on original Medicare A and B, and you're adding a supplemental, which is going to come in and sit on top of your original Medicare, basically, it affords you the opportunity to go to any doctor that accepts original Medicare. If you're looking at an Advantage plan, which is your Part C, it is going to be a bundled plan, and that is typically the biggest difference between those two is going to be your network. So it allows you to, on a supplemental, you do have to stay in the network, whereas a supplemental is going to allow you to go to any doctor that accepts original Medicare. So it affords you a lot more choices. And if you travel over 65, then supplemental is probably a better option, but not necessarily. So it's important to talk with your agent about those options. More importantly, what I wanted to stress today is what I'm seeing is a trend in our over 65 people being targeted by scammers. So they'll have a little bit of information, they'll ask for additional information, and then they're doing something, either taking money out of your account or they're moving you from one plan to another plan. So if somebody calls you and it sounds too good to be true, or they sound like they have a little bit of information, but they're asking you other pertinent private information, do not give them that information. In fact, I would get their phone number and tell them that you're going to call the Medicare office just to verify that they are who they are, and then you can call them back. I'm certain that that will discourage them from having any further conversation with you if they aren't legit. If they are legit, then they shouldn't be concerned about it. But as agents, we are highly regulated in this field to make sure that we protect our senior citizens. And we are regulated and required to get certain information and approvals from you in order to proceed further with offering you any plans. So there should be some disclaimers, disclosures, and some forms that you're signing if you're engaging with a broker about any plans or making any changes in the plan. And just understand that there's different timelines for different plans that could impact you negatively or positively. So drug plans in particular. So it's just important to understand when you make a change, how that change affects you and may affect what you're qualified to get or not qualified to get, or how that might affect what you're paying. We're also seeing a lot of times where people are being moved out of their current plan that they signed up for and being moved into another plan without their knowledge. How this is happening, I don't know. But if it happens to you, you want to bring it to the attention of the Medicare office or your broker so that they can, again, try to get these people to stop with illegitimate, writing up policies that aren't legit. So we want to stop that practice. It's really bad for us as agents, and we want to protect everybody and make sure that people are in the plans that they wanted to be in and that they needed to be in. So it's important to understand those. So let's talk about just real quick the ABCs again of Medicare. So original A is your hospitalization, B is your doctor's visits, C would be an Advantage, and D would be your drug plan. And then your plan G is going to be a supplemental. Now there's also plan Fs, there's plan Ns, there's some other ones in there, but that's probably the most popular right now. If you're over a certain age, you might be on a plan F. Otherwise, you're probably on a plan G. So those are the most popular. Those are going to, again, come in and sit on top of the original. A plan C is going to basically bundle it all together. Again, those plans look really attractive at first, but what we find as agents is that once you are on a limited budget, that sometimes those plans aren't as attractive as they once were. And so when you do start to have health issues, you then would have to underwrite into another plan and you may not qualify. We have a lot more people asking to get in a supplemental that might be in an Advantage plan that don't qualify once they have health issues. So it's important, again, when you have the option to sign up for your Medicare, which is going to be 3 months before your 65th birthday, that you pick the right plan, because that's really the best time for you to get into it, regardless of your health. It is a guaranteed issue at that time. So there are different rules for those timelines, and sometimes you can get into other plans at other times. But again, those are all conversations specific to you that you'd want to have that conversation with your agent. The other thing I wanted to discuss was, if you are on an employer's plan, you can probably stay on that employer's plan. Depending upon the size of the group, you probably are eligible to stay on that major medical plan. There are qualifications, and you do want to check with your HR department just to make sure. But if you are turning 65 and you're concerned or think that you have to get off of that and get into Medicare, you don't necessarily have to do that in every situation. So again, it's important to have that conversation to determine with your HR department whether you can stay on the plan or not. In that case, then once you aren't on their coverage or you decide to retire, then you would have a qualified event in order to get into Medicare. So there are different times and different keys to that timing to when you are eligible to be able to enroll in Medicare. It's just important to speak with an agent who understands Medicare and understands those timelines, so that we can make sure that you don't have any penalties or anything like that. So it's important to just understand what those timelines look like for you, because everybody is going to be a little bit different. If you don't have major medical coverage, let's say your spouse has already turned 65, you're now on a plan and you need to get on Medicare. Again, that's going to be 3 months before your 65th birthday when you can apply for your Part B. That will automatically, unless you're taking Social Security, that will trigger your Part A as well. And so then once you get that red, white, and blue card, you'll be able to sign up for your Medicare coverage. If you want to know more about Medicare and you want to unlock the ABCs of Medicare, reach out to us. It's KJ and John at Your Forever Agency. We're taking the hell out of health insurance.